This time of year, the sun sets earlier and earlier, and come next week, we'll experience the least amount of daylight that we've had all year. The winter solstice takes place. Did you know the longer nights can actually affect your moods? And our already moody teenagers, they're not immune.
How about moody old people like you? Yeah.
Right.
Well, this change in mood is called Seasonal Affective Disorder, or SAD. And there's more to it than just wishing for sunnier, warmer days.
Yeah, that's right. Dr. Beresin from the MGHClayCenter for Young Healthy Minds at Massachusetts General Hospital is back to shed some light on SAD. Thanks so much for joining us again. We certainly appreciate it. Now, last month, we had you on to talk a bit more about how changes in weather can affect our moods. What specific changes do we see in the winter months, and especially around the winter solstice?
Well, thanks for having me. You know, there is such an entity as a winter SAD, or seasonal affective disorder. And basically, so for teenagers, they can feel sad, crying spells, hopeless. They have trouble with their lethargy, feeling excessively tired, sleeping more, changes in appetite, especially carbohydrate craving, negative thinking they're worthless, oftentimes suicidal ideation and episodes of self-harm. And it's really a significant clinical problem for teenagers. Younger kids have these same feelings, but they also will have tantrums, clinging behavior, sometimes stomach aches, headaches, and other and oppositional behavior, defiant behavior.
So it's not just teens, clearly, but what makes the teens so susceptible to this disorder this time of year?
Well, we're all susceptible. Actually, females are 4 times more likely to get this than, and it's true for adults as well, but females, and if you have a history of depression or you have a history of seasonal affective disorder, it's more common. The reason for this is that darkness produces melatonin in the brain, which is a natural hormone that actually gets us to sleep. When there's more darkness, there's more melatonin. It also affects the regulation of serotonin, which helps keep us less depressed, but there's less melatonin. And also the lack of sunlight produces less vitamin D, and many think that vitamin D deficiency, relatively speaking, is part of the problem as well.
So this is truly a medical condition and sort of diagnosis that we have to go through. It's not just I'm feeling sad kind of situation for just a day or two.
No, it's compounded by feeling sad because, let's face it, when the weather is dark and bleak, you spend less time with other people. But for the most part, this is actually a biological condition that that affects young people as well as older people.
Well, do you have treatments for some of us that are sort of affected by this, especially when it comes to the younger groups of kids and teens?
Yeah. So there are many treatments that are very effective. The first one is light therapy, and that is there are these light boxes that produce 10,000 lux of non-UV rays, so they're not dangerous. And having 20 minutes or so of a light box in the morning and 20 minutes later in the day can actually make a big difference. Second is psychotherapy. There's cognitive behavior therapy, which helps change his negative thinking into positive thinking. There's also medications. The selective serotonin reuptake inhibitors, which are antidepressants, such as Prozac, Zoloft, and a whole variety of others, can help with this. And Wellbutrin, which is another antidepressant, can help prevent this. In addition, taking a little bit more vitamin D can also be effective. There's also, prevention methods. So, for example, decreasing stress, maintaining a normal sleep routine, making sure that you go to sleep and try to go to sleep and wake up at the same time every night. Don't take naps, no caffeine, chocolate, sodas, or any coffee or anything for 6 hours before bedtime. If you exercise in the morning and not in the evening. And blue light from screens actually suppress melatonin, which suppresses your falling asleep, which increases sleep deprivation. So we have preventative techniques that I just mentioned, and we also have treatment techniques that are highly effective. If you have any questions, I think a parent should take their youngster, teenager, or if you're an adult, go see your primary care physician and talk about this and get an evaluation.
So this is all great advice and things to look out for when it comes to seasonal affective disorder. We certainly appreciate Dr. Jean Beresin there from the Clay Center for Young Healthy Minds at Massachusetts General Hospital. Appreciate you joining us here. Just, one of those things you got to